Hi everybody. I'm redoing the video because one of you just told me that the audio was messed up and I went and checked and it looks like my microphone came unplugged. So I'm going to do it over again because I think that this information is very important. So we're at week 7 and I'm sure that many of you are a little anxious about the upcoming final exam, and I'm in the process of developing the review for that. Remember, the final review is going to be on Tuesday, February 20th, and we're going to be conducting that at 8 p.m. And I'm going to record it, so those of you who are not able to attend, you'll have the option to view it through a different pathway. I strongly encourage you to attend if you can, because I have seen issues occur with the recordings, and I really think that it's important for you to participate in this review. I think you'll definitely benefit if you do. So this week, I'm going to spend diligently going through all of your papers. You all are doing quite well on the case studies. I'm very pleased with it. So now you have your last 2 case studies. And as usual, we have our devotion and our objectives. The last 2 weeks focus on the renal and urologic systems. And last week I posted PowerPoint presentations related to these 2 systems. And I hope that you do find those helpful. And you see down here you've got the group discussions. So let's open those and see where we are. And I don't think there's going to be any further issues with the drawers opening timely. Unfortunately, Dr. Bruley was very ill with influenza and with a horrible, horrible headache. She could not get out of bed, and she is the one who opens up the cases. So she felt terrible about it, but she was quite ill. In fact, she still is having some residual issues. So unfortunately, that occurred, but we were able to get it taken care of pretty quickly. So starting tomorrow, Monday, the patient videos and assessment data will be available and reviewed by group members. The group members are to work collaboratively and create a list of subjective and objective information relevant to the differential diagnosis with rationale for each diagnosis made. And this is really important because as providers, you want to ensure that for every diagnosis that you have at least 3 differentials chosen. Those are the what ifs. And you're going to do this in practice. Remember, you're transitioning from being that RN to being a provider, and it's a huge transition. You have to use your best educated guess by utilizing the research, the resources that you have to determine what your patient is presenting with. And I have to say, in most cases, there isn't a clear-cut, well, obviously it's this. Most of the time, you can say, well, it could be this or it could be that. And a simple example of that is someone who presents with a sore throat. If somebody presents to the clinic with a sore throat, well, it could be strep, it could be viral pharyngitis, it could be gonorrhea, it could be mononucleosis, or it could be Coxsackie virus or hand, foot, and mouth. So now we have those 5 considerations. Now we need to use our resources and educated clinical critical thinking skills to determine exactly what it is. Well, with point of care testing, if that tests negative for strep, then we can safely say that there is a 95% probability that that patient does not have strep. So now we move on to the next one. With mononucleosis, the statistics are not as good with point of care testing as it is with strep, but still it's about 80% accurate. And then you're also going to look at the presentation, the onset of symptoms. So it's that big picture thinking that leads you to your ultimate diagnosis. So as I say in every class, it's like a sophisticated CSI investigation where you take all of the clues and analyze them to come up with the diagnosis. And that's what makes being a nurse practitioner so much fun, is leading that mystery to the diagnosis. Okay? So, Thursday through Sunday is when you're going to um, see the differential diagnoses revealed, and then you're going to compare. Okay, and this is a wonderful exercise because you can see, oh my gosh, this is what the actual provider came up with in that list of differential diagnoses. Now, why didn't I think of that? Um, then on Monday, the healthcare provider's diagnosis is revealed for every group's video, and each member will compare their diagnoses with that of the healthcare provider. You're going to develop a treatment plan connected to the final diagnosis and make sure that you are citing clinical practice guidelines, including medications, herbals, and procedures. A point that I really want to stress is if you are prescribing anything, I want you to write it out as though you are writing a prescription. So, when you are writing a prescription, you need to write the name of the drug, how often it's going to be given, what is the dosage in milligrams, and how often, and the length of duration of the treatment. And I'll use amoxicillin as a simple example. Amoxicillin, 875 milligram tablets. 1 tablet by mouth every 12 hours for 10 days. Quantity 20. May substitute, no refills. So when you're writing prescriptions, no abbreviations. That's out. Also, if you're going to be ordering any labs, I need to know the parameters of those labs. What's normal? What are we looking for? That's an important factor that I don't think is stressed enough in nurse practitioner education. Any referrals based on the patient's given diagnosis, if applicable, patient education, which is a really important step, follow-up recommendations, and then submit that treatment plan by Wednesday. Now, Thursday through Sunday, you're going to compare your treatment plan with that of the healthcare professional. You're going to read each other's posts. You respond to one other member's post, not in your group, of course. And then you are going to respond to some or make a response to someone who has made a comment to you. So that sums that up. Now, something I wanted to discuss too is the importance of, and I'm sure you might think that it's just an unpleasant necessity, but when you look down here at week 7, the time estimate, it's very important that you do your due diligence and complete this well, because you consider these assignments are worth a great deal of points, 200 points for these assignments. And it's a group assignment. So I have no clue if one member participated a lot more than another member. This is the only way I can tell. And I leave it to the responsibility of the group leader to notify me if there are members of the group that are not pulling their weight. And I find that sometimes this can happen with group projects. So I would like to eliminate that if at all possible. As we move forward to the completion of this course and you move on to Advanced Pathology 2, I'm going to make every effort to try and keep your groups together. And I also am going to allow you to designate who the leader will be in your group for the week. I think that will help ease you in. I highly commend you all for sticking through. You have performed at an exemplary level, and I have discussed this with Dr. Bruley to let her know that those of you who stuck it through have really put forth the effort to ensure that you are successful in this class. And I want you to know that I'm doing everything I can to ensure that you are successful in this class as well. Now that we both have a good understanding of how this course works, I think that we're going to be greatly successful in Advanced Patho 2. I will continue with the audio PowerPoints for systems. We will continue with doing exam reviews, which I do in all of my other courses. So I have advised Dr. Bruley that I'm going to continue to do these practices, and she has been it's been received very positively from her. So our exam review is on the 20th at 8 p.m. It's going to be a little on the longer side because you need to be mindful that we have 2 sections testing. And so there's a lot of material that we need to go through. Um, to ease the tension, I would greatly advise you to ensure that you have everything necessary when testing takes place. That you have a microphone that functions, you have a webcam, you've downloaded Examity, everything that you need to do, that you respond to the email, because remember, once those emails are sent out to you, they disappear in 2 days, and then you can't access it. One of the things that was discovered in the analysis of the process flaws of the last exam was that many students did not respond to the invitation timely, and it expired. So that was promoted a lot of anxiety as well. So we've learned from our mistakes, and we have put some processes in place to ensure a positive exam experience coming up next week. And please don't hesitate to contact me. Remember, the best way to contact me is through email. The worst way to contact me is through questions to the professor, because I do not see this on my phone. And I answer the majority of my communications with students on phone. Another way that doesn't work so well is if you make a response to a announcement, because I don't see that either. So there may be a delay. And my purpose is to not have a delay. I don't like a delay. Being a student myself, when I have a question for my professor, I appreciate the fact that she answers me quickly, because it's a concern for me. And I like to do that for you all too. So if I've not answered an email within 2 hours, email me again. If I've not answered that email in another 2 hours, or if you need the answer urgently, text me. Another consideration I would like you to be mindful of is that in every communication, please write your course number and your cohort number so I know exactly what class you're speaking of. All right. I hope you all have a pleasant evening, and I'll see you in the posts.